Our twin doctors, Dr. I and Dr. J, are waking up with us, answering all of your burning health questions about health, those latest medical trends we've all been reading and wondering about. Morning, guys. Happy Friday to you. Let me start with something that caught our eye that I don't know how to feel about it, but let me just say, true or false, in 2026, pregnant robots will do all the work growing human babies. I'm going to say false in doing all the work. Maybe true in doing some of it. I don't know. I don't know.
So this one is true, but it's true with the caveat. So in 2026, there will be pregnant robots. That much is true. However, they're not going to be doing all of the work. There will still be some work for you traditional pregnant ladies. So this is the deal. A firm in China actually developed a gestational robot. And so this robot, they say, can carry a fetus from the time of conception until the time of delivery. And yeah, that's a picture of it.
And is this really what it's going to look like?
Amniotic fluid. That's what it's going to look like. It's going to have amniotic fluid. It's going to have a tube connected to the umbilical cord to give baby nutrients, take away the waste. And they say that it will be able to gestate an entire baby, entire pregnancy. This is good for people with infertility, potentially people that are looking for a surrogate. This isn't great for people with ethical concerns. And for doctors, I'm like, what does this mean? Are we going to be out of a job? Are they going to come like, doctor, the contractions are coming? Like, I don't know what that's going to look like for us, but, you know, next baby, Markie, you get that gestational surrogate and I'm going to deliver it.
Yeah, I think I've had my two and done. So I'll wait and see how this works out. I have so many other questions, but we got to move on. Let's talk human aging now. It accelerates at its fastest pace when we reach the age of 30. I'm going to say false. Fastest on false.
That's false. That's false. When you're 30, you're still on the ascent. Life is great. No, so research has actually shown that aging accelerates most between 45 and 55, with 50 being the age that it really picks up. And for the longest time, researchers have wondered why. How does every part of the body know to start accelerating its aging process once you get to around 50? And what they basically found was the aorta, which is the main blood vessel that drains blood from the heart out to the rest of the body, sends signals around 50 that indicate that it's time to accelerate the aging process. And then all of the other organs kick in, and in unison, they start to release these hormones and proteins that accelerate aging. So no, at 30, you're doing just fine. When you hit 50, that's when the aging really starts to pick up.
Okay, so I got a few years ahead of me here on the ascent. I like it.
There you go.
Well, speaking of aging, let's talk longevity. True or false? The Mediterranean diet holds the key to longevity. I think in terms of food, I'm gonna go with true on that.
Yes, that is actually true. That is actually true. The Mediterranean diet is tried and true, no pun intended. So the Mediterranean diet focuses on food, right? That's the diet portion. So we're talking seeds, whole grains, fruits, vegetables, fish, lean meat, olive oil is the fat source. And that's good for our cholesterol, our blood sugar, reduces the risk of heart attack, diabetes, reduces cellular aging. So it's good in that sense. But also the Mediterranean diet focuses on activity, which is the other part of the puzzle. It stimulates you to be more active, to just on baseline, walk more, things that are going to, again, keep your weight lower, keep your blood sugar, blood pressure, cholesterol, all of those things lower. So yes, it absolutely is the way to go. And the good thing about the Mediterranean diet is they have certain morphs that look at your particular medical issues and needs and kind of tailor it to you. So it definitely is a key to longevity.
And not to mention, it's delicious. It's one of my favorite cuisines, regardless of the longevity benefits that accompany it. True or false, smoking weed can adversely affect cancer treatments? I'm going to go with true on that.
And it's actually really concerning when you consider the fact that 50% of people who are undergoing cancer treatment are also using marijuana. And that's because a lot of people promote it for increasing the appetite, which when people are on chemotherapy, their appetite's compromised. A lot of people promote it for helping with the nausea and the vomiting that you get with the chemotherapy and the cancer treatments as well. And so half of people undergoing cancer treatment in the U.S. are using marijuana to cope with some of the symptoms. But what research has recently found is marijuana interacts with portions of the immune system that can adversely affect inflammation. Now, we normally think of inflammation as being bad, right? And under certain circumstances, it is. But inflammation has some benefits as well, especially during cancer treatment. Inflammation is part of the response that allows your body to recognize cancer cells, identify, grab, and dispose of. Inflammation also helps with wound healing after you've had surgery for cancer, helps with wound healing after radiation therapy. And so basically by smoking marijuana, because you can tamp down inflammation, you can actually slow your response to cancer. And so the thought is that you may want to consider doing things that have CBD in them, but avoiding the THC.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.